OCD creates false promises, and the most painful thing about OCD is, even after thinking deeply, after seeking reassurance, or after checking multiple times, OCD never satisfies. One voice always inside us says, what if something is still wrong? And that increases the pain of OCD sufferer. OCD does not want an answer, OCD just want 100% certainty. And human brain cannot produce permanent certainty. Hello my dear ones, I'm Dr. Kashika Jain. I'm a clinical psychologist. In this video, I will talk about why OCD never feels fully solved. I will talk about this in detail, but before I begin, I want you to download my mobile app. Just type my name, you will find my mobile app. Just do the breath work and meditation daily to heal faster. So now, understand it deeply. So as you know, OCD creates a false promise. It tells you, just think a little more, check one more time, understand it perfectly, then you will finally feel settled. But that relief never stays. Because the moment relief comes, the brain asks again, did I check properly? Did I miss something? What if I misunderstood? What if this time is different? This happens because OCD is not a problem of logic. It is a problem in the brain's threat and doubt center. In OCD, brain's error detection circuit stays overactive, especially areas linked with detecting mistakes and incompleteness keep sending a signal something is unfinished, something is uncertain, something needs attention. Even when objectively nothing is wrong, so the person is not reacting to danger, they are reacting to an internal alarm that does not switch off easily. This is why, even after solving one doubt, the nervous system still does not register completion. It is like locking a door and still feeling internally, check again. Not because memory failed, because the brain did not deliver the internal feeling of done. Now let's understand. In OCD, logic always fails. That is why highly intelligent people also remain trapped. Because OCD can use logic endlessly. If someone says, you are already checked, OCD can say, yes, but maybe not carefully enough. If someone says, nothing happened last time, OCD can say, but what if this time is different? Every answer creates another opening because doubt itself is the fuel. Now understand what is at the root. OCD struggles with one thing, accepting that life can never be fully guaranteed. So healthy mind says this is probably fine and OCD mind says probably is not enough. And because probably feels dangerous, the person keeps trying to convert probability into certainty. But certainty is impossible. And impossible goals creates endless loop. So why compulsion never satisfies? Because checking gives relief, reassurance also gives relief, mental reviewing also gives relief, but only briefly. Because every time you do a compulsion, the brain learns this thought must have been important. This is why we acted on it. So next time the alarm becomes even stronger. So relief teaches OCD to return. This is why compulsion feels helpful in the moment but dangerous in the long run. And another important thing is OCD attacks to the more deeply sincere people who care deeply, who want to be correct, who want to be safe, and who want to be morally right. And OCD attacks exactly these values. OCD says a careless person would stop here, but you are a responsible person. So think about it. So a person feels stopping as irresponsibility. This is why recovery feels emotionally difficult because healing often feels like doing less when your mind says doing more is safer. Now let's understand the childhood causes. Sometimes this becomes stronger in people who learned early. Mistakes have consequences, so be extra careful, don't miss details, think before anything goes wrong. Then adulthood brings OCD and the mind becomes overtrained in responsibility. So now even normal uncertainty feels like danger. And OCD starts changing when you stop asking. Now understand what you can do. OCD starts changing when you stop asking, how do I feel fully sure? And start asking, can I move forward even while uncertainty is present? This is the turning point because recovery is not the moment doubt disappears. Recovery is in the moment doubt appears and you do not obey it. For example, you lock the door. OCD says check again, but healing says I may feel uncertain, but I am not checking again. Anxiety will rise, but you need to bear that anxiety. Your brain will scream, but just be quiet. If you stay without checking, a new lesson begins. Uncertainty can exist and nothing catastrophic happens. This is how rewiring happens. So, OCD cannot be fully satisfied ever because what OCD is demanding is 100% certainty, which life itself cannot provide. Life is uncertain, just we need to embrace the uncertainty. We need to be in the flow. We need to be happy with the uncertainty. So eventually, you have to learn to live with the uncertainty. So stop providing answer to your brain to break that loop. Just be with the uncertainty. Do one thing at a time and move on. That's how you will rewire your brain. So my dear ones, that was enough for today's video. If you like this video, please leave a beautiful comment for me and also suggest some topics so that I can make more content to help you. And also do share this video with your family, friends or other OCD sufferers to help them to recover. I will see you in the next video. Till then, you subscribe this channel and take care.